they are very grounded in their bodies, and we can use the body to sort of engage the mind in a healthy way. And this is absolutely true of kids with ADHD. And so if you follow these 3 steps, what you'll sort of find, or what I've found, is that teaching your kid to meditate becomes way easier. And by teaching them to meditate, we will be giving them a skill, or a physical medicine and rehab doctor who will teach this person how to walk again. And this is exactly what we need to do with our kids with ADHD. Today, we're going to talk about how to teach your kid with ADHD how to meditate. So the challenge is that kids with ADHD really benefit from meditation, but it is very hard to teach them how to meditate. So if we sort of think a little bit about what are we usually doing with meditation? We're sitting there, we have our eyes closed, we're doing something like observing the breath. And all of the things that we normally do when we meditate are especially hard with kids with ADHD. So instead, what we're going to do is trick them into meditating in a fun way. And then when we teach them the formal practice of meditation, they will already have figured out how to do it. Let's start by understanding how ADHD changes the brain. So there are 3 major areas that we're going to be looking at. The first problem that we see is disordered attention. So what do we mean by disordered attention? So there are actually 2 subtypes of this. The first is a high degree of distractibility, which means when I'm trying to get my mind to focus on one thing, it chooses to think about and pay attention to other things. So I'm trying to study for my math test, and I hear a loud noise or a bird flies by, and my mind is very quick to move away from this thing to other things. But disordered attention can also mean the opposite, which means that instead of changing my attention to where it needs to go, it is stuck on one thing longer than it needs to be. Classic example that a lot of parents deal with is that you are calling your child down to dinner. You're saying, hey, it's time for dinner, or it's time to get going, or get dressed, or do this, or do that. And your child is hyper-focused on what they're doing, whether it be a tablet, playing games, reading books, whatever. So what we see in ADHD is disordered attention in both directions, both in terms of a high degree of distractibility when you should be focusing, and hyper-focus when you should be shifting your attention in other directions. The second feature of ADHD is impulsivity. So this is somewhat related to the attentional dysfunction that we see in ADHD. Both of these things come from the same general region of the brain, which is the frontal lobes. But impulsivity is a little bit different. So remember that when I'm trying to focus on, let's say, a book, and then I get a distraction, a bird flies by, my mind gets distracted from here to the bird. And then what happens is I may have an impulse. Let's run to the window and see what the bird is actually doing. And yet my mind is able to restrain that impulse. So if we look at the frontal lobes, what they do is control the impulses in the other parts of the brain. And so not only do kids with ADHD get more distracted, but once they are distracted, they are more likely to follow the impulse of the distraction. So even though I'm trying to study, I think, oh, maybe I should grab my phone. I pull out my phone and then I get lost in it. So there's a problem of impulse control. The third feature of ADHD is emotional dysregulation. So this is a different part of the brain. It's the amygdala and the limbic system. And what we see in kids with ADHD is that these parts of the brain are kind of hypersensitive. So it is very easy for a kid with ADHD to get angry very easily, feel very anxious. So these parts of the brain are a little bit jittery. Not only are they more likely to get triggered into these emotional states, but in kids with ADHD, these emotional states will persist longer. So if we look at the normal function of something like the amygdala or the limbic system, it takes a certain level of stimulus to trigger activity in our limbic system. So someone has to piss me off at a certain threshold in order for me to get pissed off. Right? I can tolerate for 15, 20, 30, 60 seconds if someone is doing something irritating. But for someone with ADHD, it takes a very small signal to trigger this emotional reaction in our brain. And in a child who's neurotypical or in an adult who's neurotypical, when this part of my brain gets activated, it also calms down relatively quickly. I may get angry, but within 5 to 15 minutes, I'll be kind of back to baseline. But what we tend to see in kids with ADHD is that this emotional dysregulation persists for longer. It may be 30 minutes, 50 minutes, 60 minutes, even up to a couple of hours in the worst cases. So this is the brain that we're kind of dealing with if we have a child with ADHD. And so if you sit a kid like this down and tell them, okay, we're going to just concentrate on our breath for 15 minutes, it is going to be very difficult for the child to do because their mind has difficulty with attention, right? So telling your child to concentrate on the breath is exactly what your child can't do or has difficulty with. The whole problem is that they can't sit and concentrate on what they choose to concentrate on. And so this will result in them trying to concentrate on the breath, but they end up getting distracted by all kinds of things. The other problem that they'll have is it'll be hard for them to physically sit still for 15 minutes because they have impulses. They want to move their arm, they want to wiggle, they want to be like kind of wiggly, right? So it's hard for them to be able to do that. So what we're going to do is understand the fundamentals of meditation, because meditation is not just sitting there and observing your breath. Once we understand what meditation truly is, we can develop a customized practice for children who are neuroatypical, okay? So let's start by understanding the stages of meditation. So the first step of meditation is something called Pratyahara. So in Pratyahara, what that literally means is sensory withdrawal. So when these yogis were in India thousands of years ago, they were sort of sitting there and meditating, and they noticed that, okay, as I tried to focus on the breath, my sense organs will pull me in different directions, right? So I'm trying to sit here and close my eyes and meditate. Bird flies by, bird chirps, and this sensory input triggers the attention of my brain to go in that direction. So the practice of Pratyahara is about restraining our impulses and allowing us to focus on one thing. So how can we teach a child to restrain their impulses? So this is a wonderful game that I call Sniffer Gobbler. You can call it whatever you want to. We sort of made up this game with my kid. So basically what we'll do is I'll ask my kid to lay down, and I tell my child that there is a monster that is coming called a Sniffer Gobbler. And what the Sniffer Gobbler does is it tries to smell you. And if you move at all, the Sniffer Gobbler will gobble you. So literally what this looks like, we'll kind of show you, is that we're going to have the kid lay down, and then I will play some game with it, where the goal that the child has, the goal that my daughter has, is to stay completely still. If she moves at all, the Sniffer Gobbler will gobble her. So she's trying to sit there, she's trying to be still, and as we'll see, the goal is to keep her completely still. So even though we are playing a game, what is happening in the brain? What is happening in the brain is that there are going to be inputs, right? So I'm going to be kind of tickling her a little bit, or kind of like, messing with her a little bit. And the natural reaction when someone tries to tickle you or something like that is to move. But if she moves, she gets gobbled and she loses the game. And so what we're sort of doing is training one important aspect of meditation, the Pratyahara aspect, by engaging in this game of Sniffer Gobbler. Once we sort of do that, she will have some basic ability. She will literally practice impulse control as part of this game where you need to stay completely still. So once we've had some practice with impulse control, we are going to move to the second stage of meditation called Dharana. Dharana is the stage of meditation where we want to focus on one object for an extended period of time. So how can we train this skill discreetly for our kid? So I use a practice called tapping, and this is also like a game. So what I'll do is have my daughter lay down, and then I will just gently tap her on different parts of the body. And the whole point of the exercise is that she is going to pay attention to the sense of touch. So kids with ADHD, and generally speaking, all neuroatypical kids, are very, very grounded in their bodies. So for example, when we have children on the autism spectrum, one of the best things for kids on the autism spectrum is something called a sensory swing. So we know is when kids are autistic, they are very grounded in their bodies, and we can use the body to sort of engage the mind in a healthy way. And this is absolutely true of kids with ADHD. So if you pay attention to kids with ADHD, if they're playing a physical game, like if they're playing with a ball or they're playing on a swing or something like that, they can do that activity very, very, very easily. And that's because the somatosensory input, the signals from their body, will ground their attention. So in this tapping practice, what we want to do is have her lay down, and I'll just tap on different areas. And we're just going to train her ability to focus on what I'm tapping on. It's very easy because there's a sensory input, so we'll sort of do it as long as they can tolerate. Then what we're going to do is combine these two things into a formal meditation practice. So this may be a sitting practice where we will ask her to chant or something like that. But the key thing is that if we've done steps 1 and 2 right, if we've done Pratyahara and Dharana in a fun and engaging way, when she sits down to do step 3, it becomes way easier because her mind already knows what we're trying to do. She's going to have practiced impulse control, and she will have practiced focus. And the key thing with kids with ADHD, this is really important to understand, is that the whole reason their life is difficult is because we assume a certain functioning of the brain. And so when we think about what we teach our kids, we don't teach them the things that we assume that their brain can already do, right? So we'll sort of teach our kids how to walk, but literally speaking, we don't teach our kids how to walk, right? What we really do is we just encourage them to walk, and their somatosensory cortex, their vestibular apparatus, that's where balance comes from, all of these functions in the brain are intact. So all you do is you take a step back, you open your arms, and you say, come to me, right? And the kid's brain functions properly, so it's able to take one jittery step and then one more and one more. The child knows how to walk. So let's compare this to something like a victim of stroke. So when we have stroke in something like brain damage, now this part of the brain doesn't function correctly. And so what this requires is an additional skill set. We have someone like a physical therapist or a physical medicine and rehab doctor who will teach this person how to walk again. And this is exactly what we need to do with our kids with ADHD, because their brains are wired a little bit differently. So the skills that we take for granted are going to be difficult for them, and we need to train those specific skills. So whereas I can tell a neurotypical person to sit down, close their eyes, and observe their breath, a child with ADHD isn't able to do that quite as naturally. So we're going to train those skills specifically, and then when they sit down to quote-unquote meditate, we will have sort of caught them up to a neurotypical brain. We will have trained those skills so that they're able to do it. So in the third phase, what we're going to do is just do a formal meditation practice like chanting or something like that. And we'll also use, when I'm teaching my kid how to chant, I'll teach them about vibration instead of sound. So if you sort of think about chanting, we create a sound, right? And we also have a vibration. So if you chant something, what you'll feel is there's a physical sensation as well. And remember that in ADHD, we want to use our body to ground our attention. And so a sound involves listening to something on the outside, which will promote distractibility, whereas vibration allows us to put our attention within, which is going to make it easier for kids with ADHD. And the beautiful thing is that when we move on to stage 3, they'll have already practiced impulse control and focus. So instead of meditation being something that is grueling and difficult for them, their mind already has practice at it, and they'll sort of realize, okay, I already know how to do this. And it won't be as difficult, and they won't fight you as much. And then even for the third phase, what we really want to do is engage that dopaminergic circuitry. So in steps 1 and 2, we're sort of making things fun, and we'll do that for number 3 as well. And so one thing that I really enjoy doing is making meditation a game. So what I'll tell my kid is, okay, you're going to chant Om for 5 rounds, and what I'm going to try to do is distract you. And let's see if you can get through all 5 Oms without getting distracted. And then what we're going to do is switch things around. So I'm going to chant Om for 5 times, and you're going to try to distract me. And let's see who wins. So now we're engaging the dopamine circuitry. Now we're making meditation a little bit more fun. And when your kid is playing a game to win, it really focuses their mind in a beautiful way. And so if you follow these 3 steps, what you'll sort of find, or what I've found, is that teaching your kid to meditate becomes way easier. And by teaching them to meditate, we will be giving them a skill that will compensate for the atypical nature of their brain. We will be literally training the frontal lobes, which will improve their distractibility, which will improve their attention, which will improve their impulsivity, and will even improve their emotional regulation. In terms of timeline, what I would sort of recommend is you go at the pace that works for you. So in my case, I taught my kid to meditate over the course of about a month. And we did sniffer gobbler for maybe a week or 2. Not even every day. We can do it 2 times a week, 3 times a week. Whenever your kid feels excited about doing it, you can give it a shot. Right? So I'd say play sniffer gobbler 3 to 4 or 5 times. And then you move on to the second stage, which you do for 2 or 3 days. And then you can move on to the third stage, which you can do over the course of 3 or 4 days. And at the end of a month, hopefully your child has the basics of meditation. Now, if you run into different problems or your kid, these particular practices don't work for you, that's okay too. This is why we're teaching you all the principles. So the first step is doing something where your child has to restrain their impulses. The second step is to practice having your child focus on one thing. But remember that we want to make that practice somewhat engaging and enjoyable for the child. And the third step is to bring it all together. And this is where I really love how to add sort of some kind of competitive component to it. So not only are you going to do it, but I'm going to do it too. And let's see who can do it better. I just want to end by sharing a little bit about how what we're talking about today is a little bit different. So in my day job, I'm a psychiatrist, and I have a lot of experience. I've been practicing for about 10 years, and I've worked with hundreds to thousands of patients, and I've spent 7 years studying to become a monk. So normally when I teach, I'm sort of coming from the perspective of a large amount of expertise and experience. What I'm sharing with y'all today actually doesn't have that. Because what I'm sharing with you today comes from my experience of being a dad and having a daughter who likely has ADHD. So when I look at my daughter and I see how she struggles, how she gets the people around her get frustrated because she's not paying attention. We get frustrated. I get frustrated with her because I tell her to do something 10 times and she's not able to listen. I get sad when I see her at the playground and other kids don't want to play with her because she keeps on skipping her place in line. She ignores what the other kids are saying, and I see her struggling. And so sort of sitting down and thinking as a father with a child like this, what can I do to help my daughter? How can I take everything that I've learned in sort of treating hundreds of patients with ADHD and teaching thousands of people how to meditate? How can I combine these two things and help one of the most important people in my life? And that's what I developed. And this is what I'm sharing with you. And I hope that it'll be helpful to you. And I hope it'll be helpful to your child. So thanks for watching. Good luck and have some fun with it.